Okay, here we are with another test question, another practice question. Yes, this is a really good one. This is a good one. Very important that you know the signs and symptoms of fluid overload. Okay, let's go. Let's get started. Here's the question. The nurse is assessing a client who has fluid overload. Which of the following should the nurse expect? And here is a select all that apply. So you have to know the signs of a fluid overload in your patient. Okay, so here are the answer choices: increased heart rate, increased blood pressure, increased respiratory rate, increased hematocrit, and increased temperature. Okay, select all that apply. So don't forget, select all that apply means that it can be number 1, 2, 3, 4. It can be 3 of them, 2 of them, 1 of them, all of them. So you really have to know signs and symptoms of fluid overload. Okay, fluid and electrolytes is a difficult concept for a lot of students. So I'll give you a second to look over these answer choices and pick which ones you think it might be. Okay, Nursing with Hart, PhD, is my YouTube channel, and I'm on TikTok, Instagram. I haven't posted a lot on Instagram yet, but I will be definitely on TikTok. And it is, I think, on TikTok, I think it's, my name is Susie Q, something like that. So we're going to come back to the question and the answer choices now. Okay, so number 1, increased heart rate. An increased heart rate is correct. The nurse should expect the client who has fluid volume excess to have tachycardia and increased cardiac contractility in response to the excess fluid. So excess fluid on the heart is going to make the heart work harder. Okay? Tachycardia. Okay, number 2, is there going to be increased blood pressure? And yes, there is going to be increased blood pressure. The nurse would expect that the client who has fluid volume excess to have increased blood pressure and a bounding pulse in response to the excess fluid. Okay, on to number 3. Increased respiratory. Yes, you will see increased respiratory rate. The nurse would expect to see increased respiratory rate for a client who has fluid volume excess or fluid overload. Same thing, means the same thing. And you would expect the client not only to have increased respiratory rate, you may also hear moist crackles in the lungs when you assess with your stethoscope. You're going to listen to the lungs and you may hear moist crackles. That's the noise of the air going through the fluid in the lungs. Okay, that's a sign of fluid overload, and that's going to be mainly maybe in a patient with heart failure. Okay. So next one is increased hematocrit. Okay, no, you're not going to see increased hematocrit. You're going to see decreased hematocrit. So you're going to think about the concentration of blood and fluid. Okay, the nurse would expect the client who has fluid volume deficit to have an elevated hematocrit because of the hemoconcentration. So you think about it this way. Think about blood and fluid. Okay, if there is more, we're talking about more fluid, there would be less blood. Okay, if there's more blood, there would be less fluid. So that's a way to think about it. So in this case, there would not be an increased hematocrit. Hematocrit may actually be lower. So the increased hematocrit would be seen in a client who has fluid volume deficit. Okay, less fluid, more blood. Okay, In this case, you have more fluid, so less blood. Okay, and the last one is increased temperature. An increased temperature is also incorrect. So the nurse should expect the client who has fluid volume deficit to have an increase in temperature due to the fluid loss. So the fluid in our bodies is regulating the temperature. Okay, so if you have an excess of fluid, you wouldn't see an increased temperature. You would see an increased temperature with fluid volume deficit. So there isn't enough fluid to regulate the temperature in the body. Okay, so in this one, the correct answers are 1, 2, and 3. 1, 2, and 3. Okay, number 4 and 5 are incorrect. So you select all that apply, and this one would be 1, 2, and 3. All right, and so that's it for this question. We'll see you on the next one. Have a great day.